I am Dr. Raghu, cardiologist at Aster Prime Hospital. I have been a cardiologist for the past 25 years and I am a trained cardiologist in structural heart interventions with a level 2 master's degree from the University of Pisa, especially for the treatment of percutaneous interventions for structural heart problems. What is aortic stenosis? The blood from the heart gets pumped from the left ventricle into the aorta. The aorta is the main blood vessel supplying blood to various organs of the body. There is a valve between the left ventricle and aorta that is called the aortic valve. So, every minute the heart beats 70 to 80 times and the aortic valve has to close and open 70 to 80 times. So, that is the amount of tremendous load the aortic valve takes. Narrowing of the aortic valve is called aortic stenosis. This aortic stenosis leads to an obstruction of free flow of blood from the left ventricle to the various organs of the body. So, this leads to an increased load on the heart. That means the heart has to pump more strongly to pump out the blood against a narrowed aortic valve. So, in a patient with aortic stenosis, the aortic valve narrowing leads to an obstruction to free blood flow from the heart. What causes aortic stenosis? In the common world, aortic stenosis is a result of aging process. We all know that with aging, the eyes develop cataract, the knees get degenerated, leading to osteoarthritis and leading to knee joint replacement. Similarly, the valves in the heart, as they have to open and close continuously with every beat of the heart, these valves will get degenerated. So, this degeneration of the valves leads to the problem of aortic stenosis. In the early phases of this degeneration is called as the aortic sclerosis. So, what leads to this aortic sclerosis and stenosis are, apart from aging, the presence of high blood pressure, the presence of diabetes, high cholesterol, and also associated heart vessel blocks. That means there is some blockages in the heart vessels. All these conditions can lead to an aortic sclerosis and subsequently aortic stenosis. In the West, aortic stenosis usually happens in people who are between 70 to 80 years of age. But in India, about 1/3 of them, the aortic stenosis is an younger age disease because our valves have only 2 leaflets in about 30% of the cases. That is what we call as the bicuspid aortic valve, which is seen in about 30% of the Indians. Whereas in the West, it accounts to only 5% of the cases. So, Indians, because of the higher prevalence of bicuspid aortic valve, they tend to develop aortic stenosis at a much younger age, that means in their 60s to 70s. Beyond aortic sclerosis leading to aortic stenosis, there could be congenital aortic stenosis or sometimes some other congenital condition leading to aortic stenosis, but they are quite uncommon in elderly people. For elderly people developing aortic stenosis, it is always due to aging related degeneration of the aortic valve. How does a patient with aortic stenosis present? In the early phases of aortic stenosis, the patient might not experience any symptoms. So, many a time it would not be diagnosed. Usually the patient can experience would be presence of breathlessness or sometimes chest discomfort or sometimes sudden episodes of loss of consciousness. So, these are the classical symptoms of aortic stenosis. But in real world, we do not see these classical symptoms, but instead a large percentage of the aortic stenosis patients present with heart failure. That means they present with breathlessness, fluid logging in the lungs, fluid logging in the feet, fluid logging in the other part of the body, and many a time the aortic stenosis might be missed and could be labeled only as a heart failure. So, the common presentation of aortic stenosis right now what we see is presence of heart failure.